we'll be having an introduction to what the anticoagulant therapy is. Okay, introduction to what an anticoagulant therapy is. All right, so before we talk about the anticoagulant therapy, I just want to give you guys a small gist. So when you talk about, like, just trying to break down the terminologies, right? When you talk about anti, that's something that is against. Coagulant is like coagulation, blood cells coming together, okay, so that it can mobilize and block maybe blood leaking out and all of that. Yeah. So anticoagulant therapy is basically drugs that will stop blood cells from coming together. Just gets it at that level. So anticoagulants, they are often called blood thinners. So they are actually drugs that prevent new clots from forming. Now they help the body to also break down existing clots. Those ones, they call them the thrombolytics types of anticoagulants. So they use them in treating all these disease conditions that have to do with blood is clotting abnormally, like all those deep vein thrombosis, like all those pulmonary embolism, like all this atrial fibrillation related stroke, heart attacks and atrial thrombosis. Then also maybe you have some blood clots after a major surgery or so. So of course those medications can prevent a lot of things, right? If you have a blockage in your blood vessels, the tissues are being denied of oxygen. You understand? If the blockage is occurring in the vein, the tissues are being denied of drainage. That's like draining bad blood from them. Do you understand? So you can now have like accumulation of lactic acid. If oxygen is not being supplied, you can now start having ischemia, a lot of things. So I have the drugs here. I have a picture of warfarin. I have a picture of heparin. Okay, so I have a lot of pictures. I have a picture of rivaroxaban. I have a picture of dabigatran. So how do these drugs work? That's when the classifications of these drugs actually come in. We have the vitamin K antagonists. Examples, we have warfarin. This one, they block any blood clotting factor that is depending on vitamin K for it to actually become activated. We have the heparins. They work by enhancing antithrombin activity. Antithrombin is already against thrombus formation. Then we have direct oral anticoagulants. So drugs like dabigatran. We have drugs like rivaroxaban. We have drugs like apixaban. Okay, so risks and side effects that these drugs usually have is, well, they could actually tilt you from stopping you to make blood clots, right? Like they make your blood watery so that there's no blood clots. But how about if you get injured within that time? So if you get injured within that time, you can bleed so much, or sometimes you can just bleed spontaneously, mostly from the nose. Okay, because your blood clotting ratio is so low and all of that. So I have a picture of rivaroxaban here. I have a picture of dabigatran here. I'll upload all of them. So clinical applications, basically you use that drugs mainly for disease conditions that like the blood is now clotting like abnormally. Deep vein thrombosis. You have the venous thromboembolism, atrial fibrillation stroke, okay, post-surgical clot. Maybe sometimes your blood is clotting abnormally after a major surgery. Also management for arterial thrombosis, and also some conditions like mechanical heart valves. Like they now do a surgery to replace your heart valves, right? But sometimes when they replace those heart valves, your blood is not really used to all those man-made heart valves, so you are prone to blood clotting around them. So they can be giving you those drugs just to prevent such outcomes.